And now on SSB tax stories. In response to the rising burden of non-communicable diseases (NCDs) in Nigeria, the federal government has emphasized the need for strengthening partnerships with stakeholders, including the food and beverage industry, healthcare providers, and civil society organizations to promote healthier lifestyles and support the sustainability of the healthcare system. Coordinating Minister of Health and Social Welfare, Professor Ali Pati, made this call during the 2024 National Conference on Sugar-Sweetened Beverages (SSB tax) in Abuja. Here is the rest of the story.
According to reports disclosed by the Coordinating Minister of Health and Social Welfare during the National Conference on Sugar-Sweetening Beverages tax, the annual estimated cost of managing diabetes per person has surged from an average of 600,000 naira in 2011 to 800,000 naira in 2021, and it is projected to exceed 1 million naira by 2030. This has raised concerns about the intake of sugar-sweetening beverages without adequate regulation. The federal government, through the Finance Act 2021, introduced a 10 naira litre excess duty on sugar-sweetening beverages. Though the tax is a step in the right direction, public experts believe it is a far cry from the global best practice of 20% of SSB retail price. Speaking through Director of the Food and Drug Services Department, Farm Olubomi Arabian, the minister called for the effective collaboration among stakeholders to address this escalating health burden.
The goal of SSB tax is to reduce the consumption of these unhealthy beverages, ultimately preventing obesity and its related diseases. As we look to the future, we must view the SSB tax as a cornerstone of our strategy to improve public health and healthcare financing. By discouraging the consumption of sugar-laden beverages, we aim to reduce the prevalence of obesity and diabetes, and in turn alleviate the financial burden on our healthcare system. This tax serves as a deterrent and generates essential revenue that can be reinvested into the healthcare initiatives, particularly preventive measures and the treatment of non-communicable diseases.
The Executive Director Corporate Accountability and Public Participation Africa Akimbode Oluwafemi, while calling on Nigerians for a behavioral change in SSB consumption, called for the tax to be increased to around 130 naira per litre, or to align with the global best practice of 20 to 50% of the final retail price.
The consensus is getting clearer now that Nigeria needs a public health policy that recognizes sin tax as one of the key tools to reduce NCDs in Nigeria, as well as begin to get the necessary resources to finance healthcare in Nigeria. So we're beginning to come to that reality check for government in terms of looking at measures to protect the Nigerian citizens.
The representative of the Special Advisor of the President on Health, also lead emphasis on taxation, has been identified globally as an effective policy measure to reduce SSB consumption.
We have seen how the implementation of the SSB is able to bring in more than 700 billion naira revenue into the economy when implemented effectively. By effectively meaning that up to around 130 naira and not the 10 naira that we're talking about over a 5-year period.
The second edition of this national conference serves as an essential platform for policymakers, stakeholders, and the public health community to expand their understanding of SSB regulation, aiming to implement effective measures that align with the international standard.